Welcome everyone. Hope you're having a good afternoon. Thank you so much for joining us today. I'm Mariette and I'm a training specialist for Ardens, and I'm also joined by my colleague Charmaine Jackson, who's the head of training. Today we're going to be covering QOF for clinicians. Now, if you've joined our webinars before, you'll be very familiar with the setup, but for those of you that are perhaps new here, let's just run through a few quick housekeeping points to make sure everybody knows what to expect. So this session is being recorded and the recording will be shared with you afterwards. We will also share the slides so you can refer back to that. That way, if you've missed anything or you just want to revisit the discussions, you will be able to do so. Now, to ensure that we get a clear and high quality recording, you'll have noticed that the cameras and microphones have been disabled for this webinar, but we really do encourage your participation. So please feel free to submit your questions at any time using the Q&A feature along the top of the meeting window. This session is expected to last around about 45 minutes, and we will do our best to stick to that one. And finally, if you do experience any audio issues during this session, the best fix is usually just to leave the meeting and then rejoin. So thank you all for being here. Let's get started. Now, today's session is all about QOF and how you record your data as a clinician. So what we're going to cover today, we're going to start with why it matters. Then we're going to have a look at a very quick summary of what's changed for QOF for 26-27, and then we'll spend the remainder of the session with live demonstration of templates, analyzers, alerts, and our Ardens Manager dashboard before we finish off towards the end with next steps and training. We will also touch base during the session on any questions that might get asked there, and also just to let you know that this session is interactive and we will be launching some poll questions throughout the session just to gauge the audience opinion on things. So that brings me on to the first point. So we're going to launch our first poll and we'd love to know, what is your role? So Charmaine, if you could launch that poll for us, and then if you could click on the button there to let us know, are you a clinician? Are you an administrator, perhaps a practice manager? And that will just give us an idea of who we've got in the room and go from there.
Got nurses who are winning at the moment.
Oh, good.
A couple of pharmacists, we've got GP, a few administrators. Yeah, definitely lots of nurses in the room today.
Oh, that's great to hear. Brilliant. So that brings us nicely on to why it matters. Now, before we get into the details of what's changed for 26-27, I want to spend a minute on why this actually matters day to day, because QOF can feel like a box ticking exercise, but it really shouldn't be. So first of all, clinics. Clinics are busy. We all know that appointments are short and the list is long. There's rarely any slack in your day to go back and pick things up. Then there's complexities. More and more of our patients aren't just diabetic or just hypertensive, they're both. Plus they might have CKD, plus something else. Each one carries its own set of requirements. Another challenge can be missed coding. So the clinical work often gets done, but it's the coding that slips. And if the things isn't coded, as far as QOF is concerned, it didn't happen. And then there's the extra admin, which all then generates recalls, follow-up letters, chasing, data quality work, all work that lands back on the team weeks later. Here's the thing though, most of that hard work has already happened before the patient even sits down with us. So the admin team have done all their hard work, who have identified those patients who need to be seen to actually get them into the room. Our job now is to make the most of that opportunity while we've got that patient. How do we do that though? So firstly, we would make every contact count. So treat each appointment as the chance to close out everything that's outstanding where possible, not just the reason that they may have booked. Then there's one template with multiple outcomes. So our templates are built so that single consultations can satisfy several of your indicators at once, looking at all that outstanding work. Make sure that you're capturing everything. So we have got alerts, and those alerts flag what is outstanding in real time, so that you're not relying on memory or digging through the record, spending time there. And all of those things reduce that follow-up. If you do it once, you do it properly, you're not then generating another recall or a patient contact in a few weeks' time. So that's really the framing for today. So it's less about chasing the points, more about doing the work that you're already doing in a way that's captured the first time, and that in itself will help to achieve those points. So with that in mind, let's now have a look at what has actually changed for this particular QOF year. So we're going to start with new indicators. So this year there's been a few new indicators that have been introduced. So you'll see for your CVD domain, you've got two. So CD1 and CD2, which is all around the BP control in patients with CHD and stroke TIA. And we've also listed the points on there as well. Diabetes have had a new indicator. So this one, DM37, is all around those 8 key care processes. And with that one, it's an all or nothing indicator. So you have to achieve all of the 8 key care processes for that to achieve. Heart failure, that one has introduced treatment with an appropriate medication. And then finally, there's the obesity domain, which is new as a whole this year. So everything from your previous weight management service in the past year will now be incentivized through the obesity domain in QOF. In terms of indicators that have been updated, so you'll see that 5 of them have had updates to the existing indicators, which include asthma, that's now including patients that are 5 years old and above. COPD, they've updated the denominator itself to reduce the under and over recording of diagnosis there. Hypertension, you'll notice for that one, the update is to exclude the frailty cohort for those particular indicators. You've also got an update for non-diabetic hypoglycemia, which has added in gestational diabetes. And finally, for your stroke and TIA indicator, STIA number 7, they've added another medication to the antiplatelet options on there. Now, the thresholds and points have also seen some adjustments, and what you'll find is when they introduce new indicators or update some of them, they'll often reshuffle the point system around a little bit. So for AF number 6, you'll see that the threshold has actually increased there by 5%. So that now has an upper threshold of 95%. Cholesterol has been reduced, so that one has reduced quite a bit from 38 all the way down to 20. And finally, your diabetes. So for DM number 34, the points there have increased, as well as for DM 35, where that's increased as well by a few. Now, the last slide for the summary bits is firstly, the indicators that have been replaced. So you'll notice that all the ones listed on the screen here in the line, I won't list them all out, they are on here. So they have all been replaced with something else, which we've covered in the previous 2 slides. And then finally, childhood vaccinations. So for these ones, you'll notice that the QOF points and the thresholds haven't changed, but the things that are different is that it now has added improvement threshold calculations, which basically just incentivizes practices to do a little bit better with their childhood immunizations. And if you're able to do that, there'll be an additional payment available for that. And they've now included MMRV to count towards your achievement. So that is a very quick summary of all of your QOF. Now, before we go any further into today's session, we're just going to pop up another poll for you on there. This one is known as a word cloud. And the question here is, what is your biggest challenge when it comes to QOF? So Charmaine, if you could load that one up, brilliant. And then if you could just let us know in a few words or one word, what is your biggest challenge when it comes to QOF? Okay, so I can see on there it's popped up clinicians. So I'm guessing you mean just the volume of clinicians available to do the work. So we've got time and where to document. Oh, Charmaine, templates is on there. So that's
great.
That's a great one. understanding all the templates.
Yeah.
Yeah.
We have got a lot, haven't we? So
Mm.
coders, coding, changes.
Yeah.
Yeah, definitely changes. And that's what I wanted to mention actually. Like this summary is great, but also please don't stress that you have to remember all of that, because if you're using an Ardens template, then you'll be following all of the latest guidance anyway.
That's a very good point. Brilliant. So that gives us a rough idea of what your biggest challenges are. So thank you very much for submitting that. Then the final poll we're going to put up before we go into the demonstration today is just how do you normally record your consultation data for QOF? So that could be an Ardens template if you're already using them. Do you use another template, or do you just use non-template coding? So what we sometimes known as free coding, where you have to manually look up those codes and just add them as you're adding in your consultation notes. There's no right or wrong answer.
Well, it depends how up to date the template is.
Yeah.
Non-template coding, that's interesting.
Okay.
So I wonder what you're doing instead. Is it mainly just finding the codes and then entering the codes separately in a consultation, perhaps?
Maybe if you could let us know in the Q&A.
Cool.
Lovely, brilliant. So thank you all for submitting those. I'm now going to hand you over to Charmaine, who's going to go through the resources that we've got.
Perfect. Thank you, Mariette. So you should all now see my EMIS screen. Now, just to say that this is a test environment, so any patients that you see on screen, they won't be real patient information, but the way that I use the resources will be the exact same way that you would use it in your clinical system as well. Now, conscious that this is a short, snappy session, so I am going to try and keep it brief, but also highlight things that you definitely need to know. But also, please feel free to have it open yourself and follow along so that you know where the templates are. That's absolutely fine. If you have any questions, make sure that you're using that Q&A option, and Mariette will be there to monitor those questions and we can discuss them as we go through. So I'm going to start with templates first. So we're going to look at how you can record QOF data accurately within your clinical system. And I'm going to be focusing on long-term conditions because really the main bulk of QOF is your long-term condition management. So I'm going to focus mainly on that. But if you're interested to know how we help you with smears or vaccinations, then let us know in the Q&A and we can help you with that too. So the first thing I'm going to show you is a single condition template. So you've got a patient that's come into consultation needing an asthma review, or maybe a heart failure review, or a COPD review. So it's just that review that you're doing yourself. So the first thing we want to do is we want to access the templates. Now, there are a couple of ways that you can do this. Perhaps you might be used to being in a consultation and hitting run template and finding your template that way, and that's absolutely fine. Just make sure that when you're finding your template, you're looking out for an Ardens template, and Ardens will be in brackets. So just bear with me while my EMIS wants to misbehave, just as Ardens do this. There we go. So here we go. We've got Ardens in brackets here. So that's how you know it's one of our templates. Now that's one way that you can do it. Another way that you can do it, which you may not know about, but I really encourage you to use this way as well, is by pressing F12 on your keyboard. And what that would do is it will open up the protocol launcher screen. Now, what we have is a template launcher protocol. It's easier than what it actually sounds. It sounds a bit techie when you actually say the name. But basically what that's doing, it's allowing you to access any of the Ardens templates from anywhere in the patient record. So you can launch this F12 anywhere. And what that will then do is it will open up a consultation at the same time and save that information in a consultation. So I would encourage everyone today, if you've not done it already, to open up your F12 and make sure you have the All Template Launcher protocol on your F12 key. If you don't have it on there, it's just a case of right-clicking on a spare letter or number, clicking on Add, and searching for All Template Launcher protocol. Pop it on there, and that means that every time now you can start using that. Now, the reason why I stress that is because you have to do this for each individual. Unfortunately, there's not a way where one person can do it and it happens for everyone. Everyone needs to do it themselves. So that's your all template launcher protocol. And what that means is you press F12, double click, and that will then give you the library of Ardens templates that are available to you. Now, I mentioned that I'm going to focus on long-term conditions. So really the option I want to focus on is this one here, which is chronic disease templates, QOF. And this will give you a single template for each of the single conditions. So we've got asthma all the way down to mental health. For the purpose of this demonstration, I'm going to do an asthma review. So I'm going to click on asthma. Now, what we're starting to do is improve on our launches a lot more and almost give you a little resource package of everything that you might need for that area. So that could be the templates, it could be any documents, it could be any formularies that we offer for you. So this is another reason why to go through to our templates, so that you're getting the full access to all of the resources for that area. Now, as Mariette mentioned, when it comes to doing an asthma review or asthma work in general for QOF, the asthma register is actually looking from 5 years old. So what we've provided for you is a template to help with any reviews you're doing for children and a template to help you with any reviews you're doing for adults. So I'm going to click on adult and demonstrate how to do that, but the child one is very, very similar anyway. Now, hopefully, a lot of you, well, it shows that 10 of you are already using the Ardens templates anyway. We've got about 32 of you or 30 of you that are on there at the moment, and 10 of you are already using the templates, which is great. So hopefully most of you will know roughly how an Ardens template works in general. But normally when you access an Ardens template, on the left-hand side, we break it down by pages. That's not to cause you more work at all. What we're doing is we're breaking down the information so that anyone that is needing to record data knows exactly where to go to put that information in. If we put it all in one page, it would be too overwhelming. So we're not saying that one person comes in and completes everything. That's not how they work. You would come in and complete the information at that time. Now, the very first page of a long-term condition template will be a contracts QOF page. And what this is doing is giving you a summary of what's happening for that particular patient in their QOF journey. So at the very top, it's actually saying to me that this patient is on the asthma register. There's a green tick there. And then it will list out all of the indicators needed for QOF for this particular area, and it will give you a symbol of whether or not the patient has met the requirements. So red means with a big exclamation mark, they've not met the requirement for QOF this year yet. Green means that they have, or you might see some text that's in orange, which will let you know there's an exception code that has gone in. Maybe the patient's unsuitable, maybe they declined, and we'll talk a little bit more about PCAs in a bit. So this is really just giving me a quick glance of exactly what's happening with that patient. Remember, any data that goes into a template or in a patient record in general, we'll be able to see the last information, last time it was entered on the right-hand side. So I can see here clearly that this patient hasn't had their asthma review yet because a lot of the data was from last year. So they had their review last year, but they haven't had it for this year yet. But remember, the red symbol will tell me that as well. Now, ideally, what I want to be doing is only using this as a summary and maybe adding information that is missing near the end of the time or as and when needed. But if I want to do a full review for asthma, then I'll be encouraging you to use the review pages rather than just the QOF page, because the QOF page is letting you know what's happening, and it's almost like a tick box exercise here. What we're wanting to do is making sure that we've got a full review in place for that patient with structured information that's being used across my organisation. So I'm going to go into the review page. Now, the review page will include all of your consultation details, including best practice information that you should be following, and also, and that's like NICE guidance, etc., and also your QOF information as well. So you're not needing to go into between two different pages, providing you're working your way down this page here and you're capturing all of the details for your consultation, it will highlight your QOF information as well in this page. So once you do it here, it will also update your QOF page as well. Hopefully that makes sense. So I'm going to start from the top here. As I mentioned, I can see that the patient is on the asthma register. If the patient has, well, if there has been a resolved code that needs to go in for the patient, I can mark them as resolved, and obviously that would take them off the relevant register. But my patient still has asthma. They're now coming in for their annual review. So just down here then, I can monitor the patient's symptoms. I can see they came in for a cough back in February, but if I want to update on where they are now, I've got the drop down field there. Perhaps I need to update the family history or any additional information since the patient was last seen for their last review. Simply a case of capturing it and going down. Now, as I go down, I'm now starting to go into what the QOF requirements are. I know it's QOF requirements because it's in red, and also any payment fields will be marked with a star. So if you see a star there, that means it's for payment purposes. Now, for your asthma review, you know that there's different elements that you need to be capturing for QOF. First of all, I need to ensure the patient is on the register. They are. Second of all, I need to be looking at the number of exacerbations in the past year. I can see recently the patients let me know that they've had one, but if I need to update that at all, I've got the field to be able to do that. If you see black bold writing, this is best practice information rather than QOF information. So this is stated NICE guidance here that if the patient is on 2 or more courses of steroids and they've had 2 or more visits to an emergency department or any hospital admission, I need to just consider that there is an increased risk of poor outcomes. And remember, I can look on the right-hand side to see when those incidents might have happened or not. So I can make a decision from there. Asthma control test, this is another QOF requirement. So what I can do is I can launch the asthma control test if I need to, and I can actually complete the information. And this is where you're going to see I'm not a clinician at all. I'm literally just picking things. See the result. There's my result there. So what I can then do is I can go back into my, I can click on view results from here. Tells me what my results are. I can then go back into the system and mark what that result is. So whatever it was, I can pop that information in. If I need to update the height, the weight, the BP, I can do that as well. I can review the treatment. Remember, inhaler technique, it does show up as part of QOF as well, although it's not part of a business requirement. I don't want to make this sound really techy, but it is mentioned as part of QOF. So I can update the inhaler technique there. And then just down the bottom, I've also got an asthma management plan, which is definitely a requirement as part of QOF. So I would complete the asthma management plan in there. And then very, very last thing down the bottom, I've then got the fact that I've actually done the asthma annual review. So as long as I'm going down that page, completing all of the information, looking out for the stars, looking out at the red writing, considering the best practice information, that's all of that I need to do when it comes to completing this review and making sure that I'm recording QOF activity at the same time. There are other pages that I can go into, but I'm just conscious of time. But hopefully the page on the left-hand side is quite self-explanatory. So for instance, if there has been an exacerbation, I've got the details to be able to record a full assessment on that as well. Appreciate it all depends on what time you have. Really, the contract QOF page is just mainly your summary and updating any ad hoc QOF activity that you need to record. If you're using your review pages, it will capture everything that you need. And hopefully that makes sense. I'm going to pause just to see whether there's any questions, Mariette, and then I can launch heart failure.
Thank you, Charmaine. No questions at the moment.
Perfect. Okay. Give us the thumbs up and let us know whether that makes sense so far. Hopefully it does. Thank you very much. Thank you. What I'm going to do now is I'm going to go into the heart failure template. Very similar to asthma, but it's just giving you another example. So if I go back into my all template launcher, I'm going to go back into the chronic disease templates again, and this time I'm going to pick up heart failure. So for those of you who are doing anything around heart failure reviews, there are 2 elements that you need for QOF. One, you need to make sure you're recording an assessment of functional capacity. And the second one, you need to make sure that you're doing a medication review. So therefore, the template will allow you and help you to capture all of that information. Now, remember I said to you, the first thing it does, it will go to the QOF page. So here I can see the patient is on the register. That's all good. And I can see that they actually haven't had their review elements done this year. Still waiting for that medication review. The last time they had the med review was back in 2021. They haven't had a heart failure review yet. I know that because the information is in red. So Again, I can use the pages on the left-hand side to be able to capture those review elements. And if you look here and click on review and scroll down, you can see that there's much more information now to guide you on those requirements than just the actual code to tick for QOF. So this is actually giving you your information that you can go into if you need that further support at all. So the 2 codes needed for the heart failure is making sure that I've actually done the medication review and also making sure that I've done the actual heart failure review as well as the functional capacity information too. And there's some information on that as well. Every QOF template works the same. Every long-term condition template, works exactly the same way. Focus on your review pages. That will capture your QOF information as well. Now, we know that we don't live in a perfect world, and sometimes there are some PCAs that we need to apply. So perhaps the patient is unsuitable, or perhaps they've declined themselves. So this is where you can put in a personalised care adjustment code, or you might know it as an exception code. So again, in our QOF pages, it would be the same for asthma as well. You've got the PCA field right up the top within the register area. And this is where you can come in and record any dissent. So patient has declined or unsuitable. Maybe they can't tolerate the treatment that you're giving them. So therefore you want to mark them as unsuitable, and you're not then penalised for not doing that work for that particular area. It's just a case of picking it and that's it, save it, and that's done. And that will then work out what it needs to do when it comes to the reports and things. So that is a single condition. Most of the time, however, patients are not just coming in for a single condition. They're coming in for multiple. So if a patient has got both asthma and heart failure, and you've only got a short amount of time to be able to complete this consultation, you're not going to want to go into 2 different templates. So this is where our long-term condition review templates are really useful. So I'm going to press F12 on my keyboard, and there's another launcher that I want you to remember. So this time, it's the Ardens Launcher LTC Annual Review. What that launcher does is it takes you to everything that we do to support you with long-term condition review management, and that's mainly where patients have multiple conditions that you need to deal with. So if you've got quite complex patients, then this is a really useful one. So we have a whole long-term condition process that we provide for practices to help them bring patients in around their month of birth for all of the different reviews that they need. So what we're trying to do is reduce the amount of time the patient is coming in for a review. So the templates are therefore helping you then for when those patients are coming in, where you have multiple conditions that you need to be capturing in the same consultation. Perhaps you're running a respiratory clinic, or perhaps you're running, a cardiovascular clinic. This is where it's going to be helpful for you. So I would suggest going back, checking with your practice manager to see whether or not you are using the Ardens LTC review process. Maria, if you don't mind just popping a support article link in for LTC, that'd be good for them to go away and have a look at that as well. So as part of this, we have 2 templates. We've got the initial assessment and we've got the review. So the initial assessment template, which I'm going to launch here, is assuming that your patients come in and see the likes of, a healthcare assistant to begin with, to capture all of their examination findings before the patient then returns, either by phone or in person, to get that full review done by a GP or nurse. So for your healthcare assistant, they can come in, and this is a smart working template. So what it's doing is only showing pages depending on what condition that patient has. So under respiratory, I can see asthma there. Under CVRM, I can also see heart failure there when it loads. You can see heart failure. But actually, my patient has more than that. I can also see they've got hypertension. And if I go into respiratory, my patient also has COPD as well. So they actually got 4 conditions rather than those 2 templates that I showed you earlier. Now, this is very much stripped down, and what it's mainly doing is focusing on the QOF requirements you need, along with other information that's important for you to capture. So it's a slightly shorter template than the full review template that I showed you earlier. So I think when it comes to templates, you need to decide how much time do I have, how much information do I need to capture, is it a full review, okay, I'm going to launch a single condition template, or am I seeing a patient with multiple conditions? I haven't got the time for that. This is where these templates are going to help. So hopefully that makes sense on how you may want to manage using each of the templates within your practice. So here again, I've got the same thing. I've got the ACT score in there. I've probably got the exacerbations in there as well. I have the inhaler technique, so I would capture all of the necessary information that I need to. Now, for the nurses on the call and the pharmacist and the GP that we currently have on the call as well, the template that you would be using, so back into LTC annual review, is this one here, this option, review. So this works on healthcare assistant has now seen the patient for all of the initial examination findings. What I'm now doing is filling in the gaps from what the healthcare assistant couldn't complete. So same thing again, pages on the left-hand side. I would go into each of the pages and then capture the information. So if I'm doing a respiratory clinic, it's nice and straightforward. There's my asthma and there's my COPD page, but also noting that the patient has heart failure, hypertension, etc., etc., etc. Go ahead and I will complete that information. Remember, when I see a star, that is the requirements that you're needing for your QOF. So make sure those star ones are filled out. So that's all I'm going to cover on templates. I'm going to just cover off the QOF Analyser and also QOF Alert, and then I'm going to hand you back to Mariette. So if there are any questions, please let us know. Otherwise, I'm going to keep going. I think we have had a question in there, haven't we, Mariette?
Yep, there's one that's just popped in. So F12, what template launcher for multiple reviews?
Okay, if you're using our LTC review templates, then it's this one here, LTC annual review. If your practice is still using our previous multi-morbidity templates, which works kind of in the same way as the LTC review, which allows you to see multiple conditions, then you want to go to the all template launcher protocol. And within that, you've got multi-morbidity templates. So again, we've got one for initial assessment and we've got one for the review as well. It just depends on what you're using within your practice. So hopefully that answers your question. Now, as and when I'm completing these reviews and using the templates, it's also worth noting that in the pink box, bottom right-hand corner, we've got the alert here, which is the Ardens QOF Analyser. Now, what that is doing, it's allowing you to see at quick glance exactly what is still outstanding for that patient when it comes to QOF purposes. So if I hover over it, it tells me what condition registers they're on. So I can see the patient is on the asthma, the COPD, the heart failure, and also the hypertension. And for each of those conditions, it's still saying, look, you still haven't completed your review for asthma. You still haven't completed your review for COPD. We're doing a really rubbish job on this patient. You still haven't completed your heart failure review. You still got an outstanding BP for hypertension. So here, if I'm doing a particular consultation and I want to do a quick glance and there's maybe some things that I might be able to do. Remember, Mariette spoke about every opportunity counting. If there's anything more I can be doing with that patient in front of me, I have got the QOF Analyser, which will allow me to quickly capture information. So what I can do is I can click on that alert, and what it would do is it will fire off just a short QOF template to allow me to quickly update anything that I might have had a quick conversation with that patient about why they've been there, and I can capture that information, save it, and that will then work towards my QOF activity. The last thing I want to mention is the QOF alert. So what we have is data quality alerts that will pop up as and when in the system in big red writing. You can't miss it if there are things going wrong. Perhaps you're using wrong codes for QOF, perhaps you're missing particular QOF requirements for QOF. So a good example is, although cancer is not really part of QOF anymore, but if I put in something like renal cell carcinoma, EMIS make it really easy now, and they highlight the QOF codes that you should be using. But let's say, for instance, I've picked one that is not a QOF code. What will happen is an alert will come up on screen, which looks like this, and it will tell me the code that you're using is wrong for QOF. This is what we suggest you should be using. And then that way you're not missing out on any payment as well. So we have these alerts for areas such as asthma, cancer, COPD. Just watch out for those, read what they're saying and correct it. If you're not too sure what codes you should be using, go back to your Ardens template. As long as you're using the Ardens templates, you'll be capturing all of the relevant information that you need. And that's me. I think that's everything. So I'm going to pass you back to Mariette now just to do the last bits. Thanks, Mariette.
Thank you, Charmaine. There was just one question that popped in.
Yep.
Somebody said, if I click the lightning bolt in the pink box, will this launch all outstanding?
It will do, but that's an EMIS feature rather than an Ardens feature. So if you've still got that turned on in your practice, then you can do, and it does launch something similar, but you can do the same thing for the QOF Analyser if you're using that as well. So either way will take you to a QOF template.
Lovely. Thank you very much.
Right.
So going to finish off now on the Ardens Manager dashboard. So for those of you who are subscribers, you would be able to monitor your QOF performance using the Ardens Manager dashboard. For those of you who are not subscribers, we do offer a free trial, and I'll share the details with those at the end. And I think there is also a link that I've popped in the Q&A for you. I'm not going to cover the dashboard in great detail, so if you want a dedicated training session on this one, please do get in touch so we can go through that with you. But picking up on the examples that Charmaine used in her demonstrations, I'm currently looking at the respiratory tab on my QOF dashboard, and this will then summarize for me how I am doing with my respiratory elements. So I've got my asthma and my COPD on here. I'm currently on my data tab, so this means I can scroll down and I can have a look at the review itself, so those two indicators for asthma, and I can see using these tracker bars how close I am to my minimum and my maximum threshold. I can also use the traffic light system just in the middle here to quickly see whether I'm red, meaning below the minimum threshold, amber would be between the two, and green would be full points achieved for that indicator. Now, the bits that you might want to use on this particular page as you're reviewing patients is this outstanding, the remaining to achieve column. This one will show you how many patients you still need to review or to see to get to that full points for the indicator. The work to do column will be all of the patients outstanding, but the crucial figure here is the remaining to achieve, so that we know exactly how many we need to reach the full points for the indicator. Some of the other things you've got available on here is time-sensitive searches. So this means that particularly for things like your asthma, where you need that objective test to be done within a really specific time frame, this will highlight for you as well how long is left for those patients, so you can prioritize which ones you need to do first. Now, what you can do with Ardens Manager, rather than just looking at it to see what your numbers are, you do have access to the patients behind this. So I'm just going to use my asthma review for this one. Click on that view button, and that allows you to break down all this information. So if I was a clinician and I had my own list of patients to check up on review on, I can have a look at the progress on here. I can click on my patient tab just on the left-hand side here, and that would give me access to the patient list. Now, to kind of add to the point Charmaine was making about the QOF Analyser, which tells you what elements are outstanding, you have got something very similar to that on Ardens Manager, but it is a lot more broader. Now, what I mean by that is you'll see that for all of your patients, you have this view button next to their name. And when you click that, it opens up your single patient view. And what it does is it shows you every single report your patient is linked to in Ardens Manager that is in a to-do status. So thinking particularly for QOF, because that's the topic we're on today, we could click on our contracts button here and then have a look for this patient. I'm currently looking at my respiratory, my asthma review, but I can also see I've got them in front of me. They also need their diabetes indicators. They need some for CVD, and so on. So it's a nice, easy, quick stop to be able to see what else can I do for this patient within this single contact. So make those contacts count. And then if you haven't already got their record open in EMIS, you can then click the Open in EMIS button just in the top there, and it will launch their record for you. So it's a really handy tool to help you maximize that patient contact in front of you. Now, there's lots of other things you can do with this dashboard, but I am conscious of time. The one last little thing that I want to point out on here that does relate to QOF is looking back at my respiratory page here. Something we've not touched on yet is case finders. Now, you do need to be aware of the case finders because as a clinician, you may be asked to support with all of these case finders or to start working on them. Now, what they mean is that it's looking for patients where they are missing from your disease registers. If a patient is missing from your QOF register for respiratory, for example, that means that they are potentially missing out on the care that they need and that they are entitled to, but also it lowers the value of your QOF ultimately. So some of the things you're going to find here, if I just cherry pick some here, you've got query asthma, as they've got asthma resolved coding on their record, but they have had an inhaler in the last 1 year. So you can have a look at these patients that are identified here to see why did they have that repeat inhaler? Do they actually have asthma? And then you can add that diagnosis code back on. Similarly, for any of these other ones, so you've got query asthma because their PEFR variability is over 20% and they've had an inhaler in the last year. So it's looking at different things in their records to indicate that they're potentially missing a diagnosis code. So working through those case finders will make sure that your registers are really accurate and your patients are receiving the best possible care that they can do. So hopefully that gives you a little bit of an overview of how to use the Ardens Manager dashboard. I appreciate it's a super quick overview, but please do get in touch for further training on that if you feel your practice needs that. So I'm just going to pop back into the PowerPoint now, focusing on next steps. So now that you've seen what all the resources are and how to support you with recording your clinical data, what you'd need to do next is really reflect on the webinar and you can access our support articles. So have a little think about if you're not already using those templates, how could you adopt those in your practice? The next point would be ensure that all of your fellow clinicians or anybody involved in entering QOF related patient care have received the same training. So they can watch back this webinar, we can provide further training for your practice on that, but also you could liaise with them to make sure that everybody knows of the templates they need to use to ensure that the QOF data is captured appropriately. And finally, there's housekeeping of templates. So just make sure that your system have got all the latest templates on there and that you've removed any old ones that are not in use. And if you're going to be using our Ardens templates, making sure that you haven't got any in-house self-made templates available to confuse everybody. That leads us nicely onto training and support. So just to kind of supplement what we've already discussed. So we've got lots of training and support options available for you. So practice level training, you can email us at training@ardens.org.uk and that will allow you to book in training just for your practice on a one-to-one basis. We've got lots of different things we can cover, not just QOF. So have a little think there and let us know if we can help you with training for that. You can contact our support team if you've got any issues, and I've also linked up the support articles on our knowledge base for you on here. And also just to mention, we have something called Ardens Academy, which is our very own online learning platform. That is free to use and all the staff in your practice can sign up for their own account on there, and there's so many different courses available on Ardens Academy. You've got QOF, you've got lots of other stuff, you've got EMIS related training, so it's like a one-stop shop for your staff to do training in their own time, at their own pace, and they'll also get a certificate at the end. And some of the courses on the Academy is also CPD accredited, so well worth looking into that one. Charmaine, just checking in, is there any other questions that we need to address before we bring this to a close?
Nope, no questions.
No, brilliant. Well, thank you very much, everyone, for your time today. Really appreciate you taking the time to join us. I hope you found that valuable and you've learned something new today. If you have a couple of minutes just to give us a bit of feedback, there is a QR code on the screen and we'll share the slides so you can access that afterwards as well. Be really handy just to know your feedback on the resources, any webinars that you can do. I did notice there was a comment earlier in the Q&A, so thank you for that one, suggesting one of these type of sessions for pharmacy resources. So we will definitely look at offering something like that on a national webinar level. But that's it for today. So thanks again, everyone, and enjoy the rest of your day.